Every single week, you are eating, drinking, and breathing in roughly 5 grams of plastic, the same weight as one credit card sliding through your gut. Microplastic particles have now been confirmed in human blood, in lung tissue, in liver biopsies, in carotid artery plaques, and most disturbing of all, inside human brain matter. And once those plastic fragments are embedded inside your tissue, no approved drug exists that can remove them. Not in any pharmacy, not in any specialist office, anywhere. That is the part nobody tells you after 60. The contamination is already inside you. The medical system has no extraction protocol, and most doctors will not bring it up. But a small group of compounds, taken with your morning coffee in a specific order, show documented mechanisms for binding particles before they cross from gut into bloodstream. Before I walk you through that exact morning protocol, if research like this matters to you, the best way to keep this kind of work alive is genuinely simple. Subscribe, hit the bell icon, and share this with anyone over 50 who deserves to know what is quietly accumulating inside their own body right now. Now back to what nobody is telling you and exactly what your morning cup of coffee can quietly do that no prescription anywhere is currently being written for. That 5-gram weekly figure comes from a World Wildlife Fund commissioned analysis, drawing on measurements of plastic particles in bottled water, seafood, table salt, and airborne household dust. Researchers scaled those concentrations to typical adult consumption patterns. The number is an upper estimate, but for most American seniors, weekly intake still lands somewhere between 1 and 4 grams. What happens after those particles enter your body has now been mapped with new laboratory tools. Raman microscopy and spectroscopic analysis have made the previously invisible suddenly very visible. In a 2022 study, scientists found a median of 3 microplastic particles per milliliter of human blood, mostly polyethylene and polystyrene fragments, 11 to 30 micrometers across. Their presence in circulating blood proves these particles are not staying inside the digestive tract. They are crossing into the bloodstream, traveling through the body, and reaching tissue far away. Before we go deeper, tell me in the comments what state or country you're watching from, because I want to see how widely this conversation is actually reaching. And if you are not subscribed yet, this is the moment, because what comes next is the part that quietly gets buried under prescriptions that treat symptoms instead of sources. In 2023, a study published in Nature Medicine analyzed carotid artery plaques, surgically removed from 20 patients with advanced atherosclerosis, applying enzymatic digestion and rigorous contamination controls. 70% of those plaques contain detectable microplastics, mostly polyethylene and polypropylene, between 1 and 10 microns wide, embedded deep inside arterial tissue, not just on the surface. Surgical biopsies of liver tissue showed plastic fragments measuring between 2 and 30 microns, with over 80% of samples testing positive for at least one identifiable polymer type. Lung biopsies have detected particles as small as 1 micron, often containing multiple polymers, including polyvinyl chloride and polyethylene terephthalate, the same plastic used in soda bottles and food packaging. Autopsy series have extended these findings into the brain itself. Cerebral cortex tissue from several individuals contained 5 to 15 micron plastic fragments, confirmed through strict spectral matching protocols. That is, the wall everyone assumed was unbreachable, your blood-brain barrier, and microplastics have now been documented, crossing it in laboratory mice and detected in human brains by autopsy. Now here's the part that almost nobody outside research circles will ever explain in a 15-minute office visit, and the part where your morning coffee actually starts mattering. What I am about to walk you through is the surface. The full version, every compound, every dose, every timing window, every safety warning, is in the complete guide. Inside that guide, you will find 37 foods research links to lower systemic inflammation, including the ones the pharmaceutical industry never funded, because turmeric simply cannot be patented anywhere. You will find 47 blood sugar studies your doctor knows but cannot squeeze into a 15-minute appointment, even though the dietary correction takes about $6 per week. You will find 20 years of cardiovascular research simplified into the file your cardiologist quietly wishes every single patient over 50 would actually read before their next appointment with him. You will find 15 everyday habits that research links to chronic disease, and exactly how much each habit is silently costing your body in long-term inflammatory damage every year. 42 foods that neuroscientists themselves actually eat. 31 peer-reviewed sleep studies translated into plain English. 101 research-backed foods compiled into one practical almanac. Over 400 pages, more than 250 cited studies, every protocol step by step. The first link below this video opens the entire vault for you immediately. But stay right here with me, because the morning coffee mechanism is the foundation everything else stacks on top of, and skipping it makes everything that follows much weaker overall. Currently, no approved treatment exists to remove microplastics already lodged in your tissue. Prevention, binding particles in the gut before they cross into circulation, is the only documented strategy. And prevention happens at one specific moment of the day. The first thing you put into your stomach in the morning sets the binding chemistry for everything that follows. Coffee is uniquely positioned for this because it slows gastric emptying, extending the contact time between any binder you take with it and the contents of your upper digestive tract. That extra time matters. Microplastic particles need physical contact with a binding agent for chelation or adsorption to actually occur. The longer the contact, the more particles get intercepted. The first compound in the morning protocol is chlorella, a single-celled green microalgae densely packed with chlorophyll, polysaccharide cell walls, and unique sulfated peptides that bind heavy metals. In a randomized placebo-controlled trial, participants taking 100 milligrams of chlorella daily for 2 weeks showed 31% less urinary PhIP, a marker of a heterocyclic toxin exposure. Animal research shows up to 34% less cadmium accumulating in organs of algae-fed subjects compared to controls, the same chelation chemistry that binds plastic fragments in vitro. You stir 3 to 9 grams of chlorella powder directly into your morning coffee or a small smoothie taken alongside it. The chlorophyll core forms stable complexes with heavy metals. The surrounding molecular rings interact with hydrophobic organic pollutants, including polystyrene fragments, through ionic and non-covalent interactions documented across multiple in vitro binding studies published since 2018. If you have made it this far into this video, you already know more about what your body can actually do without a prescription than 99% of people. Subscribe and share this with anyone over 50 who needs to remember what the medical industry quietly stopped explaining once it stopped being profitable to keep teaching it openly anymore. And remember, everything research documents but nobody profits from is compiled in the complete guide. First link in the description below this video opens immediately, no hidden subscription required. Now stay with me. The next compound in this morning sequence is the one most people skip because nobody connects it to plastic, and that is exactly why it works. Spirulina, the second algae in the protocol, brings a different binding profile. Its phycocyanin pigment and unique cell wall structure trap a different class of contaminants than chlorella does. Used together at 3 to 6 grams of each per day, taken with your morning coffee, the two algae cover a wider spectrum of organic pollutant chemistries than either alone. The third foundational binder is activated charcoal. Its porous structure provides up to 1,500 square meters of surface area per single gram, vast adsorption capacity for foreign compounds. A single dose of 25 to 50 grams can reduce systemic toxin absorption by over 90% in acute exposure, which is why emergency rooms keep it on hand. For chronic daily use, the dose is much lower, 5 grams per day, separated by at least 2 hours from any prescription medication or fat-soluble vitamin you take. That 2-hour buffer is non-negotiable. Charcoal binds non-selectively, meaning it will absorb your blood pressure medication or your thyroid pill alongside the contaminants you actually want gone. This is the safety detail most online articles skip, and it is the difference between a protocol that helps you and one that quietly sabotages a medication you depend on. In humans, clinical trials using 5 grams of charcoal daily for several weeks showed only modest, non-significant reductions in markers like urinary BPA, a plastic-derived endocrine disruptor compound. Constipation and reduced absorption of fat-soluble vitamins A, D, E, and K are the most common side effects, which is why charcoal is rotated rather than taken continuously. None of these binders extract microplastics already embedded inside arterial plaque or brain tissue. They intercept new particles arriving through food and water before those particles cross into systemic circulation. That distinction matters. Once a fragment is lodged inside the carotid artery wall, no current oral compound has been clinically proven to dislodge it. The science is not there yet. What you can do every single morning is reduce the daily inbound load. Less new plastic crossing the gut wall today means less new plastic accumulating in tissue this year. And over the course of 3 weeks of consistent morning use, urinary excretion of bound contaminants measurably increases, documented across multiple chelation studies in seniors over the age of 60. That is the gut-binding half of the morning coffee protocol. The second half, the part that actually rebuilds the barriers protecting your brain, is where this gets genuinely interesting. Because binding particles in the gut prevents new entry, but it does nothing for the blood-brain barrier itself, which has already been weakened by years of inflammatory exposure. 3 specific compounds, taken with the same morning coffee at the same time as the binders, restore tight junction protein expression in vascular endothelial cells lining the brain barrier. And one of those 3 compounds is something almost every American senior household already has on a kitchen shelf, used wrong, in the wrong amount, at the wrong time daily.